I'm Philip Ward, Editor-in-Chief of AuntMinnieEurope.com. How clean is your ultrasound probe? Not as clean, perhaps, as you'd like to think. That's according to a survey conducted last year by the ECR Ultrasound Working Group. I'm very pleased to have Dr Christiane Nyhsen here from Sunderland, who was involved in the study of the group. Thank you for joining us, Christiane.
Yes, thank you.
Could you, first of all, outline the surprise findings? What really did surprise you about the survey that you conducted?
Well, I'm not sure whether surprising is, I think, one of the main findings. I think, we wanted to establish where we are, first of all, with hygiene in ultrasound and infection prevention in ultrasound. And then we wanted to take it from there to see whether or not we need to raise awareness that cleaning of the ultrasound probe should be done more efficiently, and then whether or not we need to write some new guidance maybe for the European practitioners. There have been quite a lot of publications raising awareness that there are outbreaks of infection, either associated with ultrasound gel or with the actual probes or after interventional procedures, and new guidance and new protocols have been introduced for endoscopes and things like that. So we wanted to just look at ultrasound. And the main findings really were that in Europe, and these are mainly radiologists and not the sonographers, because they were members of the European Society of Radiology that we surveyed, and quite a lot of them still don't disinfect the ultrasound probe after every patient, and this includes interventional procedures, and it includes endocavities, so transvaginal and transrectal ultrasound scans. Not everybody uses sterile gel in direct patient contact, and not everybody, even in interventional endocavity procedures, uses ultrasound probe covers. So that is quite concerning, and I think it's one of the signs that people just maybe lack awareness that there is a risk and that we maybe need to address that.
Okay. What would you say to people watching this video? How could they improve things in their own department? What practical measures could they do?
Yeah, I mean, we are really at the moment in the process of writing some guidance for all the ultrasound practitioners, and really the ultrasound probe should be disinfected after every patient, even in normal conventional surface ultrasound, where low-level disinfection is sufficient. So either cleaning your probe, letting it dry, then disinfecting it with a wipe and then letting it dry again. But for any other procedures, you should really, consider doing high-level decontamination.
What do you put this down to? Is it due to a lack of time? Is it due to a lack of resources? Is it due to laziness? What are the reasons, do you think, for it?
Well, I think a lot of it is training and awareness, and it's very difficult to prove actual cross-contamination. It's difficult to prove that a patient got an infectious disease because of an ultrasound study. So there is a certain lack of evidence, which is why this is more difficult. Once you have an outbreak and data is published, everybody stops and listens, and I think this is difficult in ultrasound to prove that. But I think generally, people are not aware, people are not trained adequately. It does take time, it does take financial sort of input into that, buying machines that can do the cleaning for you for the high level decontamination. But I think generally, in the day-to-day busy routine, it may be a challenge, but it's achievable. And once it becomes routine, once most of the centres do it, everybody will just get used to it.
Okay. Now, this week at ECR, there'll be various sessions, I'm sure, that people should go to. Which ones would you encourage them to go to brush up on their technique?
Tomorrow morning we have a session from the Ultrasound Working Group, and that's
on
addresses that.
On Thursday.
Thursday morning, Thursday morning, 8:30. There is a session that can be viewed online as well, I'm sure. And there's also patient representation and industry representation, which I think is very important, because ultimately we try to improve the decontamination procedures to add to patient safety, and we do it for the patients to keep them safe. And the industry is starting to listen definitely, and is trying to do their bit. So it'll be very interesting tomorrow morning, Thursday, to see what the patients and what the industry has to add to that.
Excellent, good. So in terms of the next step, if you like, will these new guidelines be produced that you mentioned that are being
worked on?
Yes, we're working on
this.
Should we look out for this year sometime?
Hopefully.
Okay.
This year.
And what sort of what areas will they cover? What new areas will they look at?
Well, it will basically be, how the ultrasound probe should be disinfected and cleaned and disinfected in various areas, and which probe covers to use and when to use them and which gel to use. So it will cover all of the infection prevention.
Now, you mentioned that industry is getting better, that companies are doing more. Are they doing enough?
Well, things can always be improved, I think, and you can always, do better, So there are some guidelines as well available, and we try to look at all of them and sort of trying to improve what we can, making them as simple as possible, but also as clear as possible, and that's a challenge.
Well, I wish you a successful
Thank you.
week and good luck with the next phase of the research.
Okay, thank you.
This is Philip Ward signing off for Aren'tManyEurope.com.